1.
Hi, I'm Susan McKilllop. I'm an asthma educator at Weill Cornell Medicine Pediatric Asthma Program. Today, we're going to talk about childhood asthma. Our objectives today are to get an overview of asthma. We're going to look at anatomy and physiology. We're going to talk about specifically asthma in New York City, symptoms, and the management of asthma. So how does your body use oxygen? The respiratory system is simple. You breathe in oxygen and you breathe out carbon dioxide. Our body needs that oxygen to obtain energy for all our living processes. Carbon dioxide is a waste product of that process. And here's a great picture, an example of how that happens. So when you inhale, the oxygen comes in through your lungs, attaches to the red blood cells, and goes to all your main vital organs. From there, it turns into carbon dioxide, moves with the red blood cells back into the lungs, and when you exhale, out into the air. What is asthma? We know that asthma is a chronic inflammatory disease. Some people think that asthma comes and goes, and it does. If you're under very good control, your asthma may not seem like it's there, and that's good. That's what we want. But just remember that it's a chronic disease and the inflammation is always there, even if you can't see it. So here's a good example of these pictures. The first picture is a nice normal airway. The lungs are nice and pink and the airway is open. With asthma, you always have a little bit of inflammation. That's redness and swelling. It's inside your lungs, so you can't see it, but it's always there, and it always makes your airway a little more narrow than a normal airway. The third picture we look at, it talks about when you're having an asthma attack. So not only the inflammation and the swelling, you have now mucus production, and then that mucus gets clogged when you have the bronchoconstriction. The bronchoconstriction is the tightening of those smooth muscles in your airways. So 3 things that happen with asthma: inflammation, bronchoconstriction, and increased mucus.
For the next 2 slides, we're going to take a look at some data to see how many people in the United States have asthma and how asthma affects children. More than 26 million Americans have asthma. 6.1 million of those with asthma are children under the age of 18. The third leading cause of childhood hospitalization every year is because of asthma. Asthma can cause millions of missed school days every year, which can lead to a child falling behind in class. When we look at the numbers specific to New York City, over 11% of children between the ages of 0 to 13 have an asthma diagnosis. If we look more closely, the numbers show that certain boroughs have higher rates of asthma. Almost a third of all asthma cases can be seen in the Bronx, followed closely by Brooklyn, Queens, Manhattan, and Staten Island.
All right, let's talk about asthma symptoms. Although symptoms may vary from child to child, here are a few of the most common. Cough. If your child's coughing, that means that they are having a symptom. Cough is a big symptom of asthma. It means that they might not be under good control or something's triggering their asthma. Wheezing. Wheezing is caused by the narrowing of the airway, and it's hard to move the air in and out, and you get a whistling sound. You may also have shortness of breath. Shortness of breath causes a child to breathe more shallow and to breathe more often. They're not moving the air very well, and so they're taking short, shallow breaths. And you might also have chest tightness. If your child's telling you that their chest feels tight, that's a symptom, and you need to start with all of these. You need to start albuterol right away. All right, how do we manage asthma? One of the most important things to managing asthma is talk to your healthcare provider. Have a great relationship with them, and at every visit, tell your provider what's been going on since the last visit. You also need to manage your child's triggers. Triggers are things that make your asthma worse. They could be allergens, irritants, it could be change of weather, it could be a colder virus, It could be exercise. You need to know your child's triggers. And if you don't, ask your healthcare provider to help you figure out what is triggering your child's asthma most of the time. And also the medications. Medications with asthma is very important. Sometimes the doctor has to put you on a daily medication called a controller, and those medications are what keeps your asthma under good control. If you feel your child's under good control and doing well, talk to your healthcare provider and maybe you can stop those medications. But please don't ever stop those medications without talking to your healthcare provider. And then lastly, to manage asthma is follow the asthma action plan. That plan is written by the doctor along with you deciding what's best for your child to control the asthma. If your child's having an asthma attack, exacerbation, that plan helps you step by step to what to do to help manage that exacerbation and when to talk to your provider. So thank you so much. This is a way to contact us. If you have any questions about your asthma, please feel free to reach out to us. Here's our email, our phone number, and a link to our website with more resources. Thank you and be well.